Hi, this is Jim Schreiner, the Drug Free Communities Grant Project Coordinator through the Pledge for Life Partnership and the Iroquois-Kankakee County Regional Office of Education. What I have for you today is an excerpt of a presentation delivered by Dr. Ray Bertino, the President-elect of the Illinois Society of Addiction Medicine. His presentation is on the health effects of marijuana. I hope that you find the presentation is as insightful and helpful as we all did.
One thing I want to say is that there's an information deficit out there. Educated people, a lot of times, we all get our information about various things from media, often from newspapers, magazines, and so on. What I can tell you is with marijuana, the subject is complex enough and the information stream that's carried by media just is not accurate, at least not from a medical point of view. There's probably several reasons for that. A big reason is that there's a lot of the information that is fed to the media is fed by people who have conflict of interest. By the way, I don't have a conflict of interest here. I do not, I don't have any stock in any marijuana stores or anything like that. All the work I've been doing for the Illinois Society of Addiction Medicine, which only partly is marijuana, it's most with opioids, but the work I've been doing is free. I'm an unpaid person. I'm trying to give back for all I've gotten from society. This book is of interest. I purchased this a couple of months ago. It's a report of the India Hemp Drugs Commission. And I have to realize that hemp was the term that was used by the British to describe the marijuana plant. And this really is the first, I would call it scientific, but viewing back from 130 years later, we would call it semi-scientific, but the first in-depth look at marijuana and what the effects were. Now, this is volume 1, you can see, and you can see it's pretty thick. This actually is an 8-volume set. I did not buy all volumes, but volume 1 contains most of the conclusions, and that's the reason I bought this, is to see what people were thinking 130 years ago. There were questions about medical issues concerning marijuana back at this time, and as to whether marijuana was causing problems within society, and that's what this commission was formed to try to address. And it really was the first comprehensive look at marijuana in the world. Now, if you look at reviews of marijuana, I've already told you about the report of the Indian Hemp Drugs Commission in 1894. The two most recent ones are the health and social effects of non-medical cannabis use by the World Health Organization in 2016. And then the 2017 a report by the National Academy of Sciences, the U.S. National Academy of Sciences, on the effects of cannabis and cannabinoids. Now, most of the information that I'll be showing you in this talk will come from the last of these, the report of the National Academy of Sciences in 2017. I should tell you, though, the other big recent covering of cannabis use was by the World Health Organization. You need to know there's not any big discrepancies between those two reports. Those two reports fundamentally agree with what the findings are. Now, these slides again are from the National Academy of Sciences report. Everything you see in the white on the slides, on the tables, is from the National Academy of Sciences. Anything that's in yellow is something that I have added to the report. And I'll explain why I've added things as we go along. Most of what you'll see will be in white, though. What the National Academy of Sciences concluded was that there was 3+ evidence. They scored evidences. They actually didn't use pluses, but I've converted their scoring method into 1+, 2+, 3+. But there was very good evidence from their point of view that marijuana or derivatives of marijuana were good for chemotherapy-induced nausea and vomiting. For spasticity, for multiple sclerosis, they concluded that marijuana could be helpful with good evidence. For chronic pain, they concluded that could be helpful with good evidence. Now, what I've added there is that for rare types of epilepsy, medical science now concludes that it can be very helpful, partly on the basis of new information that's come out since 2017. Many of you are probably aware that there's an FDA-approved drug called Epidiolex, which really is CBD, a component of marijuana that is approved for rare types of pediatric epilepsy. And then with chronic pain, I did put in quotation marks, neuropathic. If you read the pain literature since then, people really have questioned about whether or not marijuana helps with chronic pain across the board. There's different classifications of pain in the medical community, and the type of pain that marijuana seems to be pretty well demonstrated as helping in is neuropathic pain. Now, you might ask, what is the magnitude of effect of marijuana in these situations? And the National Academy of Sciences report did not comment on that. They didn't say if it has a slight effect, moderate effect, or a tremendous effect. And most of the magnitudes of effect on these are either slight or moderate. And in none of these cases is marijuana or a marijuana derivative viewed as being a first-line therapy. But if a person is not doing well with a first-line therapy, if they're requiring a lot of opioids for neuropathic chronic pain, well, indeed, marijuana may be something to try. If they're having nausea and vomiting that standard medical therapy is not helping with, induced from chemotherapy, again, marijuana may be, or a derivative may be useful to try. I should mention that there's FDA-approved drugs for chemotherapy-induced nausea and vomiting, and as I've mentioned, for the types of epilepsy, and for MS spasticity and for chronic pain, those indications are not approved in the United States, but they are approved in Canada and New Zealand. And I suspect over the next few years, we'll see FDA-approved drugs for those situations. Other positive effects, they found that marijuana was good for improving short-term sleep problems. Nobody would recommend it as to use marijuana regularly for sleep, but if somebody's using it because of short-term sleep problems, they found moderate evidence that marijuana was helpful. For increasing appetite in a person who has AIDS or HIV, they did find a smaller amount of evidence that marijuana can be helpful, and there is a marijuana derivative approved drug for that, FDA approved. For improving social anxiety, so you're walking into a crowded party and you feel nervous, well, use of marijuana is likely to decrease that anxiety. However, if a person uses marijuana regularly, it appears that it has a paradoxical effect in that anxiety actually increases with regular use. For post-traumatic stress disorder, they found that there was a small amount of evidence that marijuana might be helpful with that. Now, I put 2 yellow question marks after that, mainly because I follow the marijuana literature. I look at all the new marijuana articles that come out every month, medical articles, and there's about 300 of them. And I don't read each one, but I look at what they are. And if they're on PTSD, I'll look at what the findings of the article are. And from the current marijuana literature, I would say it's questionable whether it helps in PTSD. It may help in certain cases, but it's not clear that it's across the board a good use of marijuana. And it is known that there's increased risk of cannabis use disorder, a problem that you would know as addiction, in severe PTSD. One interesting finding with marijuana is it shows that there's a small amount of evidence suggesting that there's better outcomes for somebody who has a traumatic brain injury. You've been in an auto accident, you had a bad concussion. Well, use of marijuana derivatives may be helpful for getting a better outcome for you. So that's a very interesting finding. Now, you may have heard that marijuana can be used for certain dementia symptoms, glaucoma symptoms, or glaucoma problems, or reducing depression. And what the National Academy of Sciences found was 1- for each of those. Minus means that they found evidence that went against marijuana being a useful medication for any of those. And then for other things, you may have heard of marijuana for use as cancer treatment, for use for problems with Parkinson's, for treatment of addiction, for treatment of schizophrenia. Specifically in schizophrenia, CBD is what people talk about. THC would be clearly contraindicated in schizophrenia. And for treatment of asthma, what the National Academy of Sciences found was no evidence pointing one way or the other. So we've gone through the findings of the National Academy of Sciences as to what the medicinal uses or potential medicinal uses were for marijuana. Is the Illinois medical marijuana program driven by science? This is the list of conditions that are approved for medical marijuana in Illinois. And I think you'll immediately see this list is much, much longer than what has been found by science. Negative health effects. Hyperemesis syndrome. Hyperemesis syndrome was not in the National Academy of Sciences report, but anybody who is familiar with medical problems caused by marijuana will be familiar with hyperemesis syndrome. Any emergency room physician that you talk to, if you know some emergency room, if you know an emergency room physician, ask them about hyperemesis syndrome. They will know it. And they almost undoubtedly will have seen it. Hyperemesis syndrome refers to a person who cannot stop vomiting. It's interesting because marijuana helps treat nausea if used in a small amount. But if you get a person who's using marijuana regularly over a longer period of time, they can develop uncontrolled vomiting. Now, that may not seem like a big deal, and if somebody vomits for a half an hour, it's probably not a big deal. But if it continues on and on, by vomiting, you lose fluids and you lose body salts, or what are called electrolytes, and that can result in very serious problems over time. In fact, it's not uncommon for patients with hyperemesis syndrome to get admitted, mainly so they can have an IV put in to replace fluids or replace body salts. They can be discharged once they can take oral fluid and keep it down. The second one on this list, which is from the National Academy of Sciences, was the development of schizophrenia. Marijuana has a fairly strong association with the development of schizophrenia. And there are several things about that association that suggest that marijuana is causal for schizophrenia. There's good evidence also that marijuana causes increased motor vehicle accident risk. If it's used by pregnant women, it results in decreased birth weight. And that is a negative outcome. Pediatric overdoses, and I'm talking mainly about young kids here, tend to increase if marijuana is made legal. There's moderate evidence of that. And then there's a small amount of evidence that they found that marijuana can trigger MI, which is myocardial infarction or heart attack, and stroke. They also found that there's a very strong evidence that using cannabis regularly leads to cannabis use disorder, which you more commonly would know as the term addiction. Heroin addiction, what you and I know as heroin addiction. Now, if you're looking at the medical terminology, particularly psychiatric terminology, it's called heroin use disorder. If you all are looking at alcoholism, the psychiatric terminology now is alcohol use disorder. Cannabis use disorder is the same thing, but for somebody who's using cannabis. There's good evidence that marijuana can cause chronic bronchitis. The next one is interesting, that the use of marijuana seems to somehow prime the brain to be prone to developing other substance use disorders. You may know that as the gateway effect. Well, there's moderate evidence that the gateway effect is real. And then there's moderate evidence that marijuana increases the risk of suicide attempts and increases the risk of successful suicide. There's a smaller amount of evidence that marijuana causes development of COPD. COPD is emphysema, chronic bronchitis. There's what they consider to be a small amount of evidence that marijuana causes impaired academic achievement. If it's used by high school kids, that a high school kid who uses it will have a lower trajectory in school than somebody who doesn't use it, and as an adult that they'll have increased unemployment and or low income. There's an increased risk, there's a small amount of evidence that there's an increased risk of bipolar disorder by use of marijuana. The thing I want you to note, the yellow pluses there are my pluses. The impaired academic achievement, the magnitude of the effect, if it's true that there's impaired academic achievement, and I actually would put it as being a moderate evidence that there's a decreased academic achievement. But there's been several studies that have been done in Australia and New Zealand that have shown kids who use marijuana when controlling for all other things to make sure that it's not due to low income, when it's not due to child abuse, when it's not due to other issues. There are multiple studies from New Zealand and Australia that show the effect. And if that effect is real, that's a big deal. That means a kid who's using marijuana in high school, the odds are they're not going to end up at the same place in adulthood that they would have if they had not used marijuana. You may hear people say that there's not much scientific study that's been done on marijuana. Well, this is looking at all the scientific study that's been done from 1840 to 2021. You can see that on the left-hand side of the screen, it has the years there with a big red circle around it. This is from the PubMed site that's in the upper left-hand corner. So this is where physicians go looking for their medical information if they're looking for articles. And you can see that I've entered marijuana or cannabis in the title or abstract of the article. And then in the middle red arrow, you see that it's returned about 30,000 results. So there's been 30,000 results from 1840 up to 2021. If you look at the mid left-hand screen, you can see when those articles have been coming out. Between 1840 and 1967, there were very few articles coming out. But you could see they started to rise in 1967, and they're really shooting up now. If you look at the same curve for tobacco, the curve looks the same. The articles that have coming out are really shooting up just as they are with marijuana. The one difference, though, is tobacco over the same period of time has had about 130,000 articles come out. So it's clearly had more. And there clearly are hurdles to studying marijuana, hurdles that should be removed, frankly. But nonetheless, don't let anybody make you think, tell you that there hasn't been a fair amount of study done on marijuana. 30,000 articles is no small amount.